welcome everybody to the final of 4 webinars that explore how the NHS industry and academia can collaborate around digital health. This webinar is the one that I've been most excited about because it's the one that I understand the least. So I've got as much learning to do as anybody else. And this is about the role of onboarding, engaging and retaining users when it comes to digital health. And in my experience, this is often the part of digital health that gets the least attention paid to it. And you know, if you haven't got users, then you can't do the evidence, you can't do the evaluation, you can't have the impact. So it's a very, very important but often underestimated part of the innovation sort of process when it comes to technology. So this is the topic today, and we have an absolutely amazing panel to have a conversation with about this. Before we get going, I'd like to welcome Stephen Potter and invite Stephen to say a little bit about the webinar series and the pitch-in programme that this is part of. So over to you, Stephen.
Morning, everyone. I'm also one of the panelists today, so I won't spend too long introducing myself now. But yeah, just to say a word from our sponsors. The webinar series is being sponsored by the Pitch-in program. As you can see there on the slide, it's a rather convoluted acronym that stands for Promoting the Internet of Things via collaborations between higher education institutes and industry. And this is supported by Research England's Connecting Capability Fund and in wider support of the UK's industrial strategy. And the name, although it's quite long, it sort of sums it up, what we're trying to do. We're looking into the uptake of Internet of Things technologies and of digital technologies more widely, and then thinking about how best to share these results, how to promote the right way of using these technologies for the benefit of all. And just to say, by the Internet of Things, we mean the use of networked sensing devices, typically quite small devices planted around the environment, which share data about people, things, processes, and then using that data to control, to manipulate those processes and generally to improve the state of affairs. And we've been working in 4 sectors: energy systems, smart cities, manufacturing, and health and well-being. And it's in that last context, the health and well-being theme, that these seminars are being presented. Typically our work has involved sponsoring a series of mini projects, looking at different barriers in the different themes. So for example, in the health strand, we've looked at remote monitoring and diagnoses of sleep disorders. We've had some work around how do we monitor and improve obesity levels in schools by promoting exercise. How do we promote positive mental health, and so on. But it's not just the use of technology, it's also thinking about all the aspects around that, about acceptability, about sharing data, about ethical concerns, and also about what are the appropriate business models. How do we build a sustainable industry? How do we build a sustainable ecosystem around this, so that the services that we build are going to be there for the long term and not just disappear overnight. And this series of webinars fits into the wider pitch aim of sharing knowledge and experience and encouraging best practice and cooperation, but also encouraging discussion about these factors that are not always that straightforward. And a lot of the concerns really touch upon wider societal concerns about the use of data and surveillance and so on. So yeah, just to conclude, I'll hand back to Victoria now, but I'd like to thank Kat Easton, who can't be here today, unfortunately. She's teaching from the University of Sheffield, as well as Victoria for devising and organising these webinars.
Thank you very much, Stephen. If we could have the next slide, please. Mark, thank you. So yes, these webinars, as people know who've attended the previous ones, came out of sort of some scratching of heads that Kat Easton and I did together about how we could collaborate more effectively, and really just thinking about how different the language, the terminology, the way that NHS services, academic organisations and startups and SMEs tend to work and talk about digital health. So really this is about a shared inquiry, a sort of shared learning. So I work for Mindwave. We're a digital health SME and we're a spin out from the Maudsley Biomedical Research Centre. We have our roots in South London and Maudsley NHS Foundation Trust. And our core product is a personal health record that enables patients and service users to see their data and to access their data and to interact with health practitioners. I really care about this topic because back in the days when I started out in digital health back in 2013-14, I very naively worked with developers to build 5 products that never got adopted. And one of the many reasons they never got adopted was because we just didn't understand. We thought the project stopped when you handed the technology over to the client. And it turned out, as many of you will already know, that is not the case and that's not how it works. So I learned the hard way, and it's always made me really curious about how you think about the barriers and the complexities and the things that might make things not work in practice, and start to appreciate and think about those and plan for them really early on in that design and development process. So I'll be sharing my learning, and we'll be hearing from our panelists and their learning too. Please also do share your learning in the chat. One of the things that's been really lovely about these webinars is that we've had a great, rich, parallel chat going on that we're all sort of keeping an eye on during the course of the webinar as well. And I can see that people have already started contributing, and we've got a really nice mix of people on the webinar as well. So do please continue to introduce yourselves and get stuck in and share resources and so on as well. So if we could have the next slide, please. I'd like to introduce you to our fabulous panel. So first of all, I'd like to introduce Ilse, who's also from Mindwave. So Ilse, would you like to just say a bit about yourself, please? And also why you care about this topic.
Sure, thanks, Victoria. My name's Ilse Parry. I am a user researcher at Mindwave. Work alongside Victoria to understand users' needs when developing digital products and services. I've been working with Mindwave for about 2 years now. Prior to that, I had my own business as a product design consultant in the industrial side of things, as opposed to the digital side. And alongside my own consultancy, I worked for 10 years as a senior lecturer at the University of Lincoln, delivering the bachelor and master's courses in product design. I care about this topic because I feel without the users' experiences and opinions, you're not going to develop a product that has any real value. And we have to ensure that anything we are developing works correctly for the people it's intended to serve. It's also useful to think about, the definitions of onboarding, I think, are variable, but also in terms of the client expectation, getting them to understand the value in making a product that serves its users correctly, I think is really valuable from the outset.
Thank you, Ilse. And you've already just flagged up a really interesting conundrum that we have within any sort of enterprise approach, but also particularly in digital health, which is the user, the person using the product is often not the client or the buyer. And so who you're onboarding is an interesting question, because you need to onboard different people in different ways. So thank you very much for that, Ilse. Stephen, you introduced the pitching seminar series, but you held off on introducing yourself. So now's the moment. Over to you.
Now's my big chance.
Yes, it is.
Thanks, Victoria. So yeah, my name's Stephen Potter. I'm a researcher at the Centre for Assistive Technology and Connected Healthcare, which is within the School of Health and Related Research at the University of Sheffield. And I've got a background in computer science, in AI and engineering design. Although I spent most of my career in academia, I've tended to work on very applied projects, addressing what I hope are real world problems. But I've also done some work in business development, helping to manage European regional development funds, and doing some management as well in the Pitch In project. So I like to think I'm at least aware of the pressures and concerns from a commercial perspective as well. And in the last 5 years or so, I've been working specifically on healthcare technologies, covering all aspects from initial scoping and co-design, concept design, all the way through to evaluation. But rarely thinking beyond evaluation to sort of ongoing maintenance and how to retain people for the long term. And so, although I'm aware of the issues, I'm really mainly talking from an academic perspective today. And I think I'm hoping really to learn a lot about this, because it's from the other panelists, from the audience as well, because I think this is a point where there's a bit of a blind spot in academia. So I mean, just before this session, I had to check with Victoria that I actually had the right definition of onboarding, because terms like onboarding, like user adoption, retention, the user journey, user experience, they're often a secondary concern at best, especially in healthcare focused academic projects. So unless we're specifically researching interface aspects, which does happen, we're more concerned with whether the underlying mechanisms work rather than what the technology looks like, or who's going to be using it, and how they're going to be using it over the long term, and how that technology is going to develop over the long term. And I think I would say there's probably a certain snobbishness at play in this, if that's the right term. Things such as user experience, the user journey, are somehow considered less worthy of effort, or that they don't require particular skills. Anyone can make an interface or a system that people will want to keep using, or even that these decisions can be put off until later. It's just some sort of implementation detail. And so we don't always include the right experts. We don't always ask for the right advice about doing this. And as Ilse has just said, and Victoria mentioned right from the start, this is a mistake. No matter how good your underlying idea is, no matter how effective the mechanism is, if your technology is effectively unusable, then you're just not going to get anywhere. You won't be able to test your ideas with real users. You won't be able to collect the sort of evidence that you need to make the next steps to apply for further funding on the back of the evidence, and so on. So yeah, I'm hoping to learn a lot today.
Thank you for being so frank, Stephen. Only an academic could be so frank about their own about their own professional group. But I think you raised some really interesting issues there, and I guess it's about incentives as well, isn't it? Because academics are incentivized in a certain way around grants and research outputs, and an SME is going to be incentivized in a completely different way. So, talking of SMEs, really delighted now to welcome Aaron from ZenZone and Kooth. Aaron, would you like to introduce yourself and just say why you care about this topic, why it matters to you?
Yeah, sure. Hi, everyone. So yeah, my name's Aaron Sefi, and I'm Chief Research Officer at Kooth. And I'll talk a bit about what Kooth is later, I think. But I guess really the thing, my primary interest is in research currently, in developing an evidence base for what we do. But you can't develop an evidence base without the users, and you can't get the users without finding out what they need. And so from my point of view, when I say evidence, I mean the evidence of what a user is coming on for, and being able to identify that that's actually what we're achieving. So I've trained in psychotherapy originally, and worked as a psychotherapist face-to-face in mental health settings, but then working on Kooth online. We got into service management, and then got into business development of Kooth, and now in my sweet spot doing research. But I think, and what I'm particularly interested in, as I said, is in terms of aligning user needs and wants with an evidence base, so that we actually, we can do it all, rather than often it tends to be reductionist, one or the other. So yes, so I get into, I won't talk about it much today, but I'm very into measures and how we use outcome measures online, but also just how we use them in engagement with users and what is it that we're actually trying to measure. Hence those lovely 2 words on my slide, which is nomothetic and ideographic, which is, you know, all about kind of the norms and looking at, you know, what we try and get for certain buyers who want to see certain norms, but also the ideographic is critical because actually, if you don't actually uncover what users want to achieve, then you're only fulfilling one side of the bargain. So yeah, that's me.
Thank you very much, Aaron. And I guess what's really interesting about all of our speakers today and Kooth as much as any of them is that you, and we've had a few questions about scale already. Greg has said, you know, want to keen for implementation tips to scale. You are actually one of those few digital services that are properly scaling across the country. So, you know, really fascinated to understand how you went about that and what you've learned along the way. And also we're very keen today to hear about people's terrible mistakes and things they would never do again. So bear that in mind, panel. Manjul, over to you. Really delighted to have you with us. Tell us a bit about you and your company and why you care about this topic.
Sure, thanks, Victoria. So hi, everyone. My name is Manjul. I am the CEO of BFB Labs. My background is in service design. So really thinking about products, not as products or solutions or interventions, but more as services that have various actors, including service users, including stakeholders, buyers, influencers. And I guess this sort of a mindset encourages you to think about the entire ecosystem within which a service may survive, thrive, and grow. Which kind of brings me to that point that we are all sort of discussing in this particular discussion, which is around onboarding, engagement, and retention of users. And I just wanted to quickly mention that at BFB Labs, where we create therapeutic mobile games for young people, we have 3 key lenses that we measure most of our decisions against. One is whether our approach or our decision, our ideas are useful. They add to the usefulness of the general proposition of what we are working on, whether they're usable. So really thinking about the sort of user experience, usability of any aspect of our service in a very holistic way. And then of course, viability. So is it something that is going to please the gatekeepers who will eventually, in our case anyway, as we are B2B, enable access to young people to our intervention. So that's just a super quick thought on, you know, how we are approaching things here at BFB Labs.
Thank you, Manjul. And I'm really interested that you mentioned the word influencer. And it would be great to maybe get into the role of social marketing when it comes to onboarding and engagement, which again is probably a little bit of an anathema to the NHS in general and to academia as well. But it just so happens that all of the services we're talking about today are children, young people services, which is an accident rather than by design. But I think the role of the sort of influencers, social marketing, peer-to-peer, sort of leveraging that sort of peer-to-peer, I think would be something that will have application elsewhere and be really nice to unpick during the session. So thank you very much for that, Manjul. And last but definitely not least, Nihara. Welcome. Nihara and I have known each other right from way back, sort of 2014, when we both collaborated together with your very first digital product, Calm Harm. So Nihara, introduce yourself and please say a bit about why you care about this topic.
Okay, thank you, Victoria. So I'm Nihara. I am a practicing clinical psychologist. I have a very long history of working in the NHS. And I guess that what I have always wanted is to work on extending reach and access to really good quality clinical intervention. I do think that particularly for young people, the services that we offer don't really, you know, they don't really work. They don't work in the format they're offered. And although we've got all of this really great evidence base and also clinician training, it's not always that adaptable for the kind of generation that we work with. So reach, engagement and impact have been really what I wanted to do. And so I'm really passionate about using digital because I think that is such a good tool to work with young people. And we work face-to-face in schools, charities, so we kind of get feedback from schools, colleges, we work with diverse populations, we work with young people, with parents, with teachers, with GPs, with school nurses. And so we really feel that we're informed by the needs as best we can, and we're constantly learning.
Thank you very much, Nihara. And you sort of touched very lightly, but it's something I would like to actually pull out, is thinking about diversity. I think one of the things that has become very apparent during the pandemic that many of us knew, but just wasn't front and center, were issues of digital poverty and digital exclusion. And obviously in health services, we're keen to think about providing equitable services that meet everybody's needs. So it might be that we can tease out some of those issues around who's left behind and how do we onboard and engage those people that might otherwise be further excluded. So that might be something we want to pull out. So just sort of, and I've used this slide in previous webinars, but just to sort of orientate our thinking, this is adapted from Nesta's innovation sort of flowchart. And of course, this is not a linear process, but it broadly describes some of the domains that we need to think about when we're going from an initial idea where we're exploring problems and challenges, doing user research, to generating ideas to problems, to designing, developing, testing, then onboarding and engaging, delivering and implementing, and then generating evidence and sustaining. And all of you will have already started thinking, well, it doesn't happen in that order, and we need to be thinking about all these things in a much more fluid way. But obviously we've got onboarding and engaging right over at sort of step 4, and I wonder whether that is the right place to start thinking about it, and maybe we ought to be thinking about it right at the beginning. So that's something, again, I think we'll tease out during the webinar. If we could have the next slide, please. And again, particularly for the non-industry sort of participants, this tends to be, and again, a very simplified approach to designing and developing digital tools, not just in health but beyond, but this sort of iterative process. Ilse, could you just briefly, just to orientate people so we're all on the same page, just talk about this sort of what these terms mean and what they signify in terms of different stages of a design and development process?
Sure, and this is sort of very broad brushstrokes.
Yeah.
For discovery, we tend to speak to large groups of different users that might potentially engage with the product or service that we're designing. And my approach has always been to lead the team into asking some of the bigger questions around people's everyday lives and their experiences. I don't understand how else we can design products that effectively work for people if we don't get into their shoes and spend half a day there at least. So discovery is very broad in the sort of questions that we ask, and they don't always relate to a digital product whatsoever. Once we've got a rough idea of what the problems are and the user needs might be, or the issues that they face day to day, we move into the alpha phase and start to generate wireframes or user flows, user journeys, take those back to the user groups that we spoke to in discovery. And it's interesting what Victoria was just saying about onboarding being at point 4 in the previous diagram. If we can get the users engaged at the discovery phase and really get their buy-in as to the value of the product that we're trying to deliver for them, they can then follow us through this journey into alpha, where they're giving us feedback on our wireframes and our approaches and our thinking around the user journeys. And then right through to beta, once we've got most of the components and content for a digital product in place, and the developers then come in to start to code and create something that has some interaction. Then it can go back to the same user groups in a closed environment to test some of the finer details about the journeys and how the flow works, and what the content makes them understand and feel about the product that they're experiencing. Once we're in the beta phase, then you refine all of the bugs and smaller issues with larger groups of people in a phased approach, and then move to live, where you're constantly still iterating and developing and improving. But it's usually tended to be more tweaks rather than wholesale changes.
Thank you, Ilse. And I think that point about onboarding people early and then joining that journey of development with you is a really salient one, because as much as anything, this is about provenance. It's about building credibility, building trust, and people understanding that your product or service is grounded in people's experiences. It's meeting their needs. It's helping them solve their problems. And so sometimes when people just want to take something and say, I don't understand about why you need to involve people, that onboarding process is so much easier, I think, if you've done that sort of really deep groundwork right from the beginning. And, you know, we're great advocates, I'm sure all of us are, of really good user research and early discovery, because really by digging into that area, you save a lot of time and resource and heartache later on, because you can be confident that you're solving the right problems. Is that fair to say, Ilse?
Yeah, I'd agree with that. And also thinking about those early users as ambassadors really for the product, helping us spread, you know, understanding and awareness through word of mouth as you go through this process and this journey.
Yeah. Thank you, Ilse. So we're going to have sort of 3 takes here, and we're going to sort of build up. So Nahara is going to talk about things from a sort of an app perspective, about designing, developing, implementing and scaling a mobile and a series of mobile apps. Then we're going to talk about things from a games perspective. So Manjul will talk about things from a games perspective. And then we're going to move on to Kooth, which is more of a platform with multiple different services. So we're going to sort of think about this from a number of different sort of vantage and product viewpoints. But yeah, Nahara, over to you. It'd be lovely to hear about how you, in the design and development of Clear Fear and your other products, how you've sort of tackled this issue of onboarding engagement, and just talk to us about what your levels of engagement and retention are like for your users as well.
Okay, so we've got 4 apps. Our first app is Calm Harm, and our latest app, Move Mood, was only released end of December. What has informed us in terms of our digital development has been really the work that we've done in schools and colleges. So we have found, in terms of onboarding, that we need to get ourselves to places where children and young people are. We need to be able to offer something to those organizations that then help to start that conversation going. So we start off with providing a whole range of mental health literacy to schools and colleges. We do that through various talks, through running conferences for the range of audiences that we talked about. We feed into the school PHSE, RSE programs, and through that we're able to get lots of engagement about really what teachers might be noticing, what young people are saying their friends are concerned about. And we start from there in terms of then trying to match young people's needs to the digital product. And then we will keep working with our school groups to help us to inform, and it feeds really well into young people who might be interested in tech, for example, young people who might want to kind of perhaps apply to psychology at university. So we have got lots of interest from young people for a variety of reasons, or maybe because they're supporting themselves or supporting someone else in terms of the products. Our first app, Calm Harm, which we developed about 4 years ago, 4.5 years ago, is to help users manage their urge to self-harm. It uses a form of treatment called DBT, which is actually really quite difficult to access. There's only very few specialized centers that offer it, and we've used just one element of DBT within the app, which young people like. And although it's a very niche app, you would think, in terms of self-harm, it's actually proved to be an enormously used and downloaded app across the world. And the way that it has been promoted it's been a bit of an organic growth really, but it's been very much through social influences and through the kind of social proof that young people require to be able to use a product. So we have, we've got, I don't know, over 1.5 million downloads across the world. We have about 20% retention, but young people revisit it from time to time. And Shall I keep talking, Victoria? I don't know whether
keep going. Yes, this is fascinating.
One of the things that then led us to develop our second project, and which has also helped us to sort of start to think a little bit more about the consequences of developing a digital product, is that we found that a number of our Calm Harm users were actually using the app to help them with multiple other mental ill health conditions. So we had a number saying, oh, we're using it to help us manage other impulsive behaviors such as addictions or bulimia, or indeed that a lot were using it to help manage anxiety. And so we then went back saying, well, actually, to our user group saying, well, actually, there are even more evidence-based treatments, as in CBT, let's say, for anxiety, that might be helpful. What do you think of this model? And so we developed Clear Fear on the basis of that, together with sort of our feedback that we had about saying actually anxiety was a really useful element to kind of try and develop Clear Fear on. So we've got Clear Fear, which has been unsurprisingly used and downloaded a huge amount of times throughout the pandemic. And the consequence stuff has meant that we've actually now trained in a model, which I don't know whether the panel or the audience are familiar about. It's a form of agile training called consequence scanning. And it's something that has been promoted by Dr. Everyone, but basically it's a really simple model, and it's looking at whether the digital tool you product, what impact it has on the people who use it, but also in a wider context on the environment, for example, on the community, because it might actually have both intended and unintended consequences. So for us, the unintended consequence of Calm Harm was that people were using it for all sorts of other mental ill health issues. And whilst that might be a positive, we also had to then start to think about whether that met up with our clinical safety guidelines and with our values, etc. And then Clear Fear has led on to our third app, which is we had a group of parents say, actually, we want something to help support our young people and friends. So we developed Combined Minds, which supports parents and provides them with an alternative way to support young people who might be in distress in the moment. And interestingly, over the pandemic, we've had a change in user group. So we've had a lot more young people, a lot more university-based young people using it to support their friends who they might not see. So we've been developing more user interaction on how we need to adapt the app to kind of serve this user group. And then our latest app, Mood, uses a form of treatment called behavioral activation, which is all about increasing your motivation to change depressed behaviors. And again, post at the pandemic time, that's been really important, because one of the things young people we find have really lost is their motivation to kind of keep engaging post lockdown.
Nihara, we've had a really interesting question through the chat, which is asking what your revenue model is. So you've obviously developed this whole suite of mobile applications that have sort of related uses, and how do you make this sustainable?
Right. Okay. So we've developed the apps through grants, and they have come either from Tech for Good, Comic Relief Paul Hamlin, or our very first app was through NHS Digital. In terms of sustainability, we don't believe in charging young people. So we offer all of our apps free, which actually keeps the engagement going, I think. But in order to therefore make it sustainable, our business model is to license our apps to various organizations. So we've got some licenses with NHS trusts. We've got one with Leeds Council, so that's public health. We've got one with a private organization that works with young people. And we've also just last year established a CIC where we will be potentially developing a paid for app where all the monies will go towards providing our free apps for young people. So that's our business model.
So Nihara, your sort of approach is that the apps that you've developed are like an adjunct to the work of your charity, aren't they? So that's maybe quite a different model to Kooth, for example. So and could I just ask you? So I think with Manjul we'll talk more about the engaging young people, but you're clearly a clinician. You're working a lot with schools and the NHS and so on. How important when you're thinking about onboarding the buyer, if you like, the payer, which is the organization. How important is it that you carry that knowledge and that expertise as a clinician?
So we're very, very important to kind of have a really robust clinical safety model. And one of the things that we used to do was we used to develop our alpha or our beta model and then think about our clinical safety training and developing our hazard logs and thinking about all of that. And actually now we have our clinical safety engagement groups, which is a group of clinicians, a group of users, etc., right at the beginning. And we keep that process iterative all the way throughout. So I'm very, very clear that the tools that we provide are not replacements for treatments. They're just an alternative form of a kind of use that young people can have on managing specific behaviors in the moment. And we make sure that we have some sort of inbuilt analytics to look at that effectiveness. And we have very good effectiveness data based on that. And we also try and have some ethical committee approved sort of pre and post sort of research measures, which we're doing at the moment. We've got quite a large study for clear fear at the moment.
So what I'm really picking up from that is that when you're thinking about onboarding your gatekeepers, if you like, your organization, actually the usability and the desirability of the app to the user is of less importance to them than the evidence, the efficacy, the safety, the safeguarding. Those are the sorts of things that they're going to be thinking about. So you've got to balance all of that sort of hard stuff, if you like, against this has got to be really desirable and usable, and it's got to feel relevant to me. And so those are two quite different things with two quite different users, but both of them are equally important.
Absolutely, and that's a really difficult balance, because obviously we need to ensure that that safety is in place, and also that the model that we're offering is true to the model itself. But of course, a lot of young people will tear apart that model and say, well, actually, we won't use that bit, or, you know, we'll use this bit. So again, it's about making sure that what you offer will bring about behavior and thought change. So it's always a tough balance to make sure that that's the case.
And actually an interesting point that people end up using products and services in ways that the people that develop them don't always intend or anticipate. So I think that's a good point to move over onto the next slide, please. And to invite Manjul, tell us a bit more about BFB Labs and your approach in terms of onboarding and engagement and retention with your games products. And it'd be really nice to really major on that design thinking approach, which I know is your real sort of strength and background, and the engagement with young people themselves as a user group.
Sure, absolutely. Thanks, Victoria. I'll also take questions. If anybody has anything that springs to your mind, just drop it into chat. I've got the window open so I can pick it up. Yeah, so I guess just taking a step back and, you know, really talking about working in this complex sort of field that we are active in, all of us, all the panelists, I guess. I think BFB Labs is comparatively newer on the scene, especially, you know, with the likes of Kuth, ZenZone, and of course Calm, who we've all sort of researched to death, learning about, you know, how they've got all the users that they've got and so on and so forth. I think with BFB Labs, because we are comparatively new, one thing that we understood when we were setting out was that a lot of the interventions today, a lot of the products today were either coming out of digital agencies that deliver high quality user experiences, but probably fall flat when it comes to being able to provide good evidence and effectiveness behind the interventions, or they were coming out of, you know, collectives of academics and clinicians where there's really top quality collaboration in place, and everything is sort of backed by evidence. It's scientific. You can see all the data. However, perhaps sometimes the user experience was comparatively more compromised. So we sort of sit somewhere in the middle of all of this, and the approach that we have developed is slightly hybrid. We take on board service design thinking model and principles as our approach. We bring together the therapeutic models that we base our products on, and then also bring into the picture responsible and immersive gaming frameworks. So if you think about it, when there are three circles overlapping with one another, This gives us a unique opportunity to unlock new value points by providing highly engaging therapeutic games, which are mobile applications accessible by most smartphones and tablets, that are also able to provide data in real time securely. So all of our interventions are CE marked medical devices, which basically means for anybody who's not familiar with that lingo, that they're able to meet the highest standards of clinical safety and data security. So I've said quite a lot in the last few sentences, and each one of these attributes of what we do actually stems from quite a lot of the work and research that we've done over the last 5 years. We don't look at products, as I mentioned earlier, we look at them as services that exist within a service system, which already exists. So you can't just come in with something that is brand new and flashy and looks beautiful, works great, but just doesn't have that interoperability element fitted within it. It doesn't have the adaptive sort of attributes in it. And then, of course, because we're looking at things from a holistic service system perspective, we hone in on every potential touch point with every key actor within that service system and try to add value where we can, because sometimes BFB Labs may not be the best entity to say anything. We may have, nothing to say, or we may have things to say, but nobody who would pay attention to it. So we kind of really look at things in a very sort of reflective, very self-aware way to see where we can unlock value in different touch points. And also, Dr. Nihara, you've talked quite a lot about user needs already. And one thing I wanted to quickly mention is user needs and understanding pain points is key to how we work in the sector, because everything that we are doing, all the different sort of panelists from different organizations are creating things that are quite novel. They aren't any existing formulas that we can say, okay, well, Google Maps did it like that, or a taxi application did it like that, or a dating app did it like that, so we can follow the same formula. There aren't any formulas. So you're constantly having to sort of figure stuff out, which basically means that we don't just look at, I guess, the pain points at the user needs, but we also extend our understanding to really getting to grips with how people perceive what we are able to offer to them. Not only whether they're clinicians, whether they're academics, whether they're young people, families, and all the other sort of stakeholders, teachers, etc. So really understanding that. And one of the questions in the chat box was, when does onboarding start? So onboarding doesn't start when you have a ready product. Onboarding starts when you think of a problem. From that point in time, like for the last sort of 3 years, we've been thinking about onboarding, and we only launched our interventions in September 2020. So we actually started selling properly 4 months ago. And the onboarding process, the planning, the development of touch points, the collateral around that, everything started ages ago, thoroughly tested. And I don't think that anybody's got it right. I feel like this is a highly iterative process. Every time we put something in front of people, there's always somebody who has some feedback, which is great. The more feedback we get, the better we can make what we are trying to do. And I think when it comes to engagement and retention, it's a little bit easier in the B2B2C space than B2C to retain customers. And the simple truth behind that is that once NHS organization introduces a new service or a new product, chances are they're going to struggle to not make it available if it is successful in a year, 2 years time. If what you're doing is able to fulfill the different promises it makes to the buying organization, chances are that they will keep you for as long as the product's use is relevant. So I think then the focus kind of comes back to really getting your first users, which in a B2C space where you are creating products that, you go on your app store, you pay a little bit of money, you download the application, or you sign up to a subscription, is a very different story. Because Victoria, going back to your point around social marketing, that's where those sorts of things, the digital channels, digital marketing channels, can really be harnessed. What we find, however, because we also sell to the healthcare sector here in the UK, which is a centralized healthcare system, even though they have 200 odd different types of buyers. We find that it's often more a case of convincing the gatekeepers than actually convincing families and young people. Simply because the area that we work in mental health tech, there are fewer options and perhaps some other areas, for example, fitness tracking or wellness, and so on. So really, it is a case of making sure that you are able to deliver against the key requirements, the key requisites outlined by the gatekeepers, ensuring that you are able to understand and tune in to their perception of your product, not just what you're telling them, but how they are perceiving it, and really making their life easy. I mean, if you can alleviate 5 pain points for them, then that's a clear win-win situation. And I'm happy to say that since launching just 4 months ago, we already have sold to 6 different NHS organizations, which is, for us, it's quite rewarding, simply because we are, as I said, comparatively younger in our journey, comparatively quite early in our journey in comparison to other panelists. So once you have your first users, case studies, building an active community, and using that on digital marketing channels, on PR channels, is really one way to let everybody know that, look, this thing that you've made, this novel thing that maybe somebody has never seen before in the version and the format that you've created it in is working. And then really going back to Nihara's point, it is about making sure that you have some sort of an ongoing feedback loop. And something we learned quite early on was that clinicians and commissioners want data. They want to know whether the thing that you're presenting is working or not, if it's effective, if it's fulfilling its promise. So we have created a data platform, and we are able to provide that information in real time securely. So that becomes a really good way for us to sort of inform our products as well.
And Manjul, could I ask you to really drill down into sort of in a very granular way? So sometimes when we talk about onboarding, we've been talking about it fairly broadly, but onboarding is literally, I download the app and I log on for the first time, and how easy is that process? And I just wonder whether you could say, because one of the things that Stephen Potter talked about was academics sometimes, I know he was generalizing, don't give value or appreciate just how important a user experience is, just how it needs to be simple, it needs to flow, it needs to convey trust, or it needs to feel like I look at it and go, actually, that's a sort of thing that fits with my identity. I relate to that. It's one of the reasons why pendants in supporting older people in their own homes have not been that appealing, because you've got to wear a horrible big thing that sort of carries a load of stigma with it around your neck, for example. So what just talk about some of that, how important it is to just get that onboarding process for each individual as elegant as possible.
Yeah, I guess the onboarding part, like once you know about the product and you have access to it and you can download it and you can start using it, you really have a few seconds to convince the user that this app is designed and made for you. It isn't designed for the adult in the room, in another room in the house. It is really designed for you. And for BFB Labs, we did extensive levels of testing. We actually created our onboarding concepts in the form of board games well before we even went digital, trying to qualify some of the decisions, some of the journeys that we were mapping at the time. And what you'll find if you do get the onboarding right is that onboarding is a real opportunity not only to convince the user to stick to their user experience and continue through that journey in that particular application, but also it is an opportunity for you to inform them, for you to prime them for the sort of next modules of experiences that they might potentially have. When you do have a dull or a disengaging user experience, a little bit like a movie, you see a trailer, the trailer doesn't excite you, you're probably never going to watch the film. The same concept with applications as well, and people are really used to high quality content. Nobody has the time or the patience to work with an application, be it a software application or be it a web application, which doesn't deliver in terms of time, in terms of seamlessness, in terms of engagement. I find that young people themselves can be, quite critical. If they don't like something, it's definitely out of the window. So we are up against a really tough customer base here. And as I mentioned, the board game mapping, doing it in as lo-fi a process, breaking it down and being ready to be ripped apart, to have your ideas ripped apart by young people, by your service users, I think is something that you would probably hate at the time, but you'll be grateful for when you do end up building a product. So fail early, learn as much as you can, and definitely get your onboarding right.
Yeah, so you ignore that at your peril, I think, is the is the lesson here.
Absolutely.
Thank you so much, Manjul. Now, over to you, Aaron, because you have a different proposition again, which is much more of a platform with a whole variety of services. So this feels to me like quite a complex offering. So it'd be great to know who your users are, who your buyers are, and how you're meeting each of their respective needs, and a little bit about how you're managing to deliver that at scale.
Okay, thanks. Yeah, yeah. I think I just want to start at the beginning a bit, because I think there's quite a different context that we came from, and what I'm hearing from, particularly from Manjul and Nahara, is quite a bit more of a sophisticated approach that's come along since we came along, if you like. And I think we've had to adopt that more sophisticated approach. But certainly when we started, it wasn't that sophisticated. So, because we started in 2004, before Facebook, which was an odd claim, think about it. And yeah, so online mental health and wellbeing support for children and adults, but I'll talk mainly about children now. So at the moment, we're commissioned in just under 90% of CCGs in England. So we're pretty much the whole of England commissioning Kooth now, partnering with the NHS predominantly, although actually when we started, it was with local authorities, and it was a very different landscape then. So yeah, the main thing is early intervention in mental health, early help. And like Manjul was saying about the Venn diagram, in terms of the different stakeholders, if you like, involved in the development of Kooth, we were very much therapist led. So the person that started off Kooth was a therapist, and she saw the gap in what was happening in CAMS services, even in school-based counselling services that were just kind of burgeoning at that time, which is, it's 1 hour a week, and that's not enough. And digital could provide something else in terms of support for people as and when they need it, rather than in this kind of fixed way. And so really it was about following that therapist-led view and then looking for the technology to support it. And so it was, in the early days, it was literally just finding the tools. So finding the ability to have a text-based chat conversation, the ability to have some forums, and the ability to have some content. And that was basically where Kooth was born, from that. And then it really developed, as I say, from early days of kind of local authorities showing an interest and commissioning it, to then broadening out when CCGs, when a lot of the money moved across to CCGs for mental health. It was all about getting those engaged early and getting those gatekeepers, as Manjul was describing. And that was quite a, there was a touch and go period when we only had about 6 or 7 contracts, and there was a big reform of the NHS at that time. It's about 2010, 11, and it looked like we weren't going to survive. But then we just managed to unlock something with a few more. Actually, I mean, ironically for us, I've been asked about this before in the past. What the best thing that actually helped us spread was commissioners getting jobs in other areas, and actually going to that and saying, "Oh, I commissioned Kooth in Manchester," and then commissioning us from the new area that they were. So literally that kind of dispersal across the NHS by people moving around. And so, yeah, I think, I just want to say a bit about onboarding really as a key bit. So when we win a contract in an area, we have engagement workers, a bit like Nahara was saying. It's critical in schools to get people in there. So we promote in schools heavily. We promote in GPs, in CAM services, in youth services, what there are. We do the digital promotion, but the critical bit is getting other stakeholders engaged in it, adults, parents, teachers, practitioners, and getting the name around and getting the identity around, so that users will, young people will, you know, want to come and find out what we're about. And so that's, you know, I think that's probably been the critical bit, that because then we get the numbers in, and then we're able to demonstrate worth to commissioners, who can then come back and commission more, because typically we would start in quite a small contract base. So it's brought us to where we are now, where we've got about 100, last year we had just over 168,000 new users. So it's about 15,000 new users a month coming in, and just under 1 million logins. So that gives you, if you're quick on maths, it gives you about an average of 5.2 logins per user. And I did a piece of work last year where we looked at the kind of the different levels of users, because you've got those people that, well, you've got the people that come and see it but don't actually register, and then you've got those that register and use a bit, and then you've got those that register and use a bit of content and a bit of engagement with the community, and then you've got those that come into counselling, and then you've got those that stay in counselling for a longer period. And as you get that funnel getting smaller and smaller as you go. Yeah, so that was a really interesting thing to start to identify what it is that's sticky, and what it is that actually helps users want to stay around. And so we did a big piece of work a couple of years ago where we improved a lot of our community support around creating more activities, which you can see on the right there, actually, I think. And I think that really, and we were able to identify just how much that is now building a better stickiness in our users in terms of staying around and using what they need and as they need it. But of course, the question is always in all of that is, how much do they need and how much do they want? And you know, that's an ongoing question for us, particularly from a therapeutic point of view. You know, it's not about kind of keeping people forever, because you know, there can be different challenges within that as well. So now, you know, we've reached this point where we're, as I say, a bit more of a sophisticated hybrid of clinical governance, of UX and UI, product managers, designers, content writers, frontline engagement workers and practitioners, all contributing, obviously critically alongside users in co-production, to actually keep developing the model and what we're trying to do there, and trying to keep ahead of that all the time.
One of the things that interests me, Aaron, and Nahara picked on it as well, is that you've got the sort of the onboarding within the app itself and the retention, but actually what you're describing is a lot of in-person activity that is about raising awareness, getting engagement, building trust, and how important, or what percentage of your effort when you're going into a new local area is directed at that? Because that sounds very labour intensive to me.
It is. It's a big investment for it, but we in terms of, you know, economic model, we built that into the contract. So we ensured that we would have no contract with the CCG where we're not funding some sort of work in schools and promotional work, because we knew that it just wouldn't stick without it. So we built that into the economic model from the beginning, really. And actually, right at the beginning, what we did initially was actually deliver face-to-face services as well. And we still do. We've got about 7 counselling services across the country, and they were really important just to kind of ensure that we were there, present in that way. And I, you know, that may be a stretch for a lot of people thinking about how they can do, but I guess it's whatever you can do to build into that model the engagement levels. Yeah.
I think it's useful for people developing digital tools to be thinking about not just the onboarding process with getting someone to an app through an app store or even through a clinical service, but just all that engagement work you might need to do to build sort of trust and credibility within the organisation or the region. The other question I've got for you, Aaron, is around stigma, because we're talking about mental health here, and there's 2 things. One is, I think it's fair to say that the attitudes are shifting, but essentially you're asking, you're promoting something at scale within a locality, a topic that many people feel embarrassed or uncomfortable or ashamed about, and then you know, when I'm using my banking app, all my interaction, I get my needs satisfied within the app. I do the thing, I transact, I'm out again. But often within a health app, you're asking people to do things outside of the app that has an impact on their mental health. The activity is not just within the app, and I suspect that creates a little bit of a degree of complexity for people, because they've sometimes got to be thinking about stuff they don't really want to have to think about, or they might not want to have to do, that might have a positive impact on their health and well-being.
Yeah, I think that's really interesting, and I think for me that's where my value base around humanistic model of therapeutic approach comes from, because I think for us it's always been about using the tool and the technology to create a relationship, and so the relationship is between the user and the practitioner, the user and other users, but also quite interestingly between the user and the product itself. You know, we get a lot of interesting quotes from young people, particularly saying how it's Kooth that they love, and it's almost it's this brand or this idea of what it is that they feel attached to sometimes within the product. So, and I think, for us, I mean, a critical feature in all of this was anonymity, which I haven't really mentioned yet, which is that, you know, users sign up anonymously, and you know, in terms of the battle that I think both of you were mentioning before, in terms of between the user and the buyer, you know, early on it was a very much, you know, it was very difficult to sell to commissioners an anonymous service, but we had, in a way, we had stigma on our side there, because we used the argument of stigma to say, well, this is why they need to come onto an anonymous service, because otherwise it's going to be harder for them to. But actually, the reason that we really love an anonymity is because it keeps people engaged with what we are about, which is actually it's like it's getting under that radar of what they are, what they've typically what they might be looking for from a mental health service, and actually engaging with them in that way. So I've done a lot of work around, you know, whether or not a user actually sees, even though it's a human interaction, they don't see the practitioner as fully human in themselves, and there's something that's happening under that radar of consciousness where they're actually coming in because they're not seen, and you know, because they can't be identified. So another big battle we had once was around video conferencing. It's like, why don't you do it? But that would have broken that barrier of anonymity and that wall that users wanted to retain at all costs.
That's a really good point, because I think there is sometimes an assumption that face-to-face is like the gold standard and any sort of digital intervention is like substandard. But actually, and a lot of the evidence is around blended, particularly in mental health, blended therapies are sort of the most efficacious. But actually, for some groups of people, anonymity might be the thing that's the big bonus, and also text messaging or using instant messaging might be much better than video or phone calls, for example, just because of norms about how people prefer to and are used to communicating in other aspects of their lives.
Yeah, that's it. I mean, that's it. It was about familiarity, particularly for our young users, but now our adults similarly have grown up. A lot of them have grown up using it in that way. So yeah.
I'd like to just sort of move on to some of the challenges, but I just wonder, Stephen, whether I could bring you in, because you know you were great at fessing up that you were like, what even is onboarding, and you talked in your introduction about you know, some perhaps in academia this sort of stuff isn't taken that seriously or isn't seen as that important, or it would just be good to get some of your reflections really about how, you know, what you're learning from these sort of those three sort of case studies, but also how you think this might be built into how academics might work slightly differently with these topics.
Yeah, I mean, all three case studies are really excellent. I mean, there's but one thing we can see from the screenshots there is the amount of effort, I think, that's gone into the interfaces. And that's from an academic point of view, I think that's kind of a key question. How much effort should we put into our interfaces? How do we reach the point where the interfaces are good enough to do our trials, to reach proof of concept stage, to get the evidence that we need to go forward? And I think that's a rhetorical question. I don't think there's an easy way of answering that, other than being aware that we do need to put the effort in. We do need to find ways of building into our research models, our research teams, the expertise and the resource for doing this. But on the other hand, I'm not sure that the funders, the typical funding bodies that we apply to, recognize this. And I think there's a problem there. If we built a work package that was just in inverted commas based around the user experience, the user journey, I think perhaps they'd have the same reaction as a lot of academics. So why are you putting so much effort into that? So I think there's a real dilemma there within academia, and it does hinder transferring some of these really good ideas beyond academia, I think.
Thank you, Stephen, and some really good comments and observations sort of coming in through the chat as well. I always think it's good to learn from what goes wrong. So I wonder if I could invite members of the panel just to maybe share an example where they've done something wrong or it hasn't quite worked and they've had to change how they've done something to optimize that retention. And I'll start with something you might want to comment on this, Ilse, but it was really struck me. So with our personal health record, there's a function within the personal health record that enables a person, a patient, a citizen to communicate with their clinician, and clinicians, not always, but sometimes and often, get very nervous about the idea that they might be able to securely communicate through the application. And one of the things we learned was that if it was designed to look like instant messaging, the clinicians were freaked out about it. And I think I'm right, Ilse, aren't I? I can't think, we won't say which trust it was, but we had to sort of redesign the interface so it looked much more like an email. So it was something about through the design that inferred the type of interaction. So it was like a real micro example of how just designing something to look different can create its own trust and help people feel confident in a product. Is there anything you'd like to sort of elaborate on there, Ilse?
Yeah, I think that's quite an important point that hasn't really been mentioned specifically so far in the chat, is that idea of visual language and how people understand the things that they see, how it relates to them, how it connects to them, what it evokes in the mind. Could be related to personal experience, a specific memory a person has had. And obviously you can't take account of all of those things for all of the users, but you can get a fair idea if you do good discovery work.
Yeah, thank you, Ilse. Nihara, what have you learned? If you could, thinking about, this audience who are really interested in this topic, maybe they haven't thought about it that much before, could you sort of pull out a little nugget of like, oh, we really learned the hard way that that's not how you, not how you do it?
I think there's something about not over offering, which is a bit of a weird one to say, because it's a little bit like when I cook, I kind of tend to overcook for people. But I think there's something about when you're a clinician and you know that there's so much stuff that you can provide to someone, to kind of potentially put that all on there. And I think apps in particular that we create need to be really simple to engage the young person, and we need to really find that nugget of what that simple thing is, what they most need to be able to do that. So I think that's one of the things we learned, was that I was saying, well, we're doing this model, so we could do this and we could apply this. And actually what we found was it created too much noise. People got a bit too confused with it all. So I think it's translating information and kind of making it useful.
That's a really good point, Nihara. So when I've worked in the past with clinical teams, sort of like their specification, what they want to include, gets bigger and bigger, and suddenly it's a personal health record. Yeah. And I think what you've done that's really elegant is you've just done one thing, one small thing in a really in a really elegant and simple way. So I think that's a really good insight, is don't try and boil the ocean. I always remember a developer saying to me, start with one thing and only develop the next feature when people are begging you for it. When they're sending you emails going, why can't we do this? Then you know it's time to develop the next feature, rather than trying to do everything and sort of slightly confusing people. Manjul, what's your insight? What give us a nugget of what you've learned about what not to do when you're thinking about these issues?
Sure. So I guess one of the things that we learned the hard way was I guess the thinking that everything you do has to be sort of centered around the child in our case, because they were supposed to be our service users. So we wanted to give them maximum choice, maximum control, applications that they can use at their own pace, in their own space. But we were designing something for young people as young as the age of 7. And that brought in that key question of safeguarding. So you were getting a lot of slack for you're increasing screen time. You are potentially putting the child at risk, because our intervention does encourage, a little bit like Pokemon Go, for the child to go out of the game and do certain challenges and come back and report back into the game. So we thought it took us some time to understand how we could bring the guardian into the picture without taking the control away from the child. And this, I think, took a lot of battering that we received from young people and from parents over a period of, I don't know, maybe 18 months. And what we eventually did was we developed an automated SMSing system where the game would fire out an SMS apprising the guardian of what the child's progress was within the game, and if at any point in time they were about to go out of the game and actually attempt a challenge. And we have like a locking, unlocking system built around that. But we, I guess, sort of kind of took the point around being user-centric, very seriously. And we were always sort of challenging ourselves that, does this mean that we are compromising on the child's ownership of the gameplay experience, and so on and so forth. So that was, I guess the key thing that we took away from that experience was, like, rules are there to be broken. And at the end of the day, when somebody might have made a rule that might have been in a very specific context, in a very specific situation, our context, our situation is different, it's novel. So if the users are telling you, and if, well, the influences of that user's experience of your product are telling you to change tack, there's just no harm in actually doing that to make your product work.
Thank you, Manjul. And I think you're talking about trade-offs as well between different users, which is a really interesting one to think about. Aaron, what have you done horribly wrong at Kooth that you're willing to share that we can all learn?
Yeah, I've been musing that one. I am willing to share one that is still a problem, and so it's quite close to my heart, really, because I think what we're talking about in terms of, like I mentioned, about the conflict between the user and the buyer. I think, we haven't talked a lot about data, and one of the key aspects of our success, I believe, was our ability to provide really useful data and insights from a very early stage to our commissioners. But one thing that we ended up over-promising in a way was the level of data of users as they onboard the product. And so we are now, even though it's still only, whatever it is, 12 clicks or something like that, it's too many. It's still too many to get into the service. We're getting demographic details, we're getting different aspects of, geographic details and a few other bits like that, which we're now having to retro approach and go back to commissioners and say, actually, we don't want to give you all this for every user. We want to let users come into our service more gradually and find a better way of onboarding them so that there's a better experience for them. And that's a challenge, because then, because people get into data and they get data hungry. It's like, I want more of that, And so to actually say we want to give you less is quite a big.
Well, that's often clinical services want tons of data, don't they? But asking for all of that data up front when you're not giving enough value to people straight. You need to give value to people as quickly as possible, I guess. Yeah. And the more data you ask up front, the more you compromise the value, but also maybe concern about where that data is going and so on before people have got familiar with your product.
That's it, yeah. So yeah, that's a big one. And I would also just reflect in terms of keeping it simple. And Nahara was saying, I think we've avoided lots of mistakes by saying no to a lot of things.
Nice. So the role of saying no and being firm. And I think we would relate to that as well, wouldn't we, also at Mindwave? It's about, actually, let's not do everything. As Nahara says, let's not try and do all these different features, even though our client might want us to. How do we educate and work with them to not compromise the user experience, because they will have pulls on them around data, for example, and evidence and so on. Now, unfortunately, Ravi's had to leave, but he asked a brilliant question, which is a sort of conundrum that's been going on in my head, really, which is about, and you talked about the complexity of it, is about retention. So Nahara, you said you had about a 20% retention rate, but I guess it's different to, you know, if you're running a game, you just want, and you're commercializing a game, you just want people to be on that game for as much as possible. But when you're supporting someone to reduce the need to self-harm, you don't want them on the app if they don't need it. So how do we make sense of what retention even means when it comes to something that people are using for a health challenge that they may solve or resolve? Any reflections on that, Nahara? Because I can't
I
wrap
think
my head around that one.
it is a really tricky one, because I think retention is very different when you are looking at certain behaviors, because you don't want them to almost be on the app for too long, because it means that maybe it's not working necessarily in the best way. So we've got things around, you know, the time people stay, we'll have little warning signs saying, you know, you tried it a few times, do you want to kind of perhaps have a break, try something else? So we sort of almost actively encourage people to try other alternative options, particularly if they're rating that their urges aren't reducing. But I think it also depends on what we are retaining, because that's the other question that we find difficult. Are people using it for the cause that it's out there for? Are they using it for other reasons? So what we try our best to do is we look at user feedback. We really try to refresh our data based on that feedback so that we know we're kind of continuing to offer something. So we have very big quarterly updates on stuff that we do. And I think we kind of look at things around progress as much as possible.
So really what you're saying is retention there are other metrics that are better, which is about are people getting benefit from the app. Now listen, we've only got 10 minutes left, and I'm slightly ditching the slides because I think we're just having a general conversation, but I just wonder whether we could touch on diversity, because one of the things that always sort of is in my mind and troubles me is, are we, through digital services, giving increased access to people that already readily have good access, and are we inadvertently further excluding people? So how do we think about accessing users and people that might benefit who might not be the obvious people? And I wonder, Manjul, whether you might talk to that through some of your games about how do you account for different user needs in terms of accessibility, for example?
Sure, I guess that's a really interesting point, and I think we are one of the few 90% female migrant teams working here at BFB Labs, which basically means that we really do challenge ourselves on, you know, the decisions we make around user experiences and accessibility, of course. I think it's quite widely understood that games are often boy-centric. You know, the types of Fortnites and Zeldas and so on and so forth. You get a very small percentage of girls who are actually playing those games. And then there's, of course, no data around other gender identities and definitely no sort of ethnic background behind these. So one of the things that we've made sure we are able to do is our gameplays experiences can be had without any access to internet. We do suggest that there is connection to the internet at least once a week so that data can be sent through. And then, of course, when it comes to, I guess, not having access to devices themselves, which is something that a lot of young people are faced with because of digital poverty, we enable access through any mobile device. So be it a parent's device, be it a guardian's device, a trusted adult's mobile phone, for example. And this also relates to some of the technicalities around the software application size and so on and so forth. And then, of course, within the games themselves, we have, you know, of course, we have responsible gaming. So gameplay experiences are limited to a certain amount of time in the day so that kids can't actually do binge gaming. And then a very easy thing that we were able to do in our game is avatar customization, which has representation of different disabilities, ethnicities, gender identities, race, which is something that really helped bring down a lot of barriers, because young people can create an avatar that they can actually relate to within the game. Of course, when it comes to making our games more accessible to young people with learning disabilities, there's a huge sort of range of needs there, and we are working on it. I would never say that we are scoring 10 out of 10 on that agenda, but it's something that we are really, really keen to sort of push forward with and continue sort of innovating around. I think there is another question around accessibility, which I think Dr. Nihara had touched on previously, which is how do you make sure the families that do have good access to support already are not the only ones benefiting from what we are doing. And again, to Nihara's point and to your point as well, Victoria, we are setting 2 NHS organizations who can make our products available for free to families in their specific region so that we can survive and young people who we want to provide support to are able to access the support as well.
Thank you, Manjul. I mean, it's lovely to hear how deliberate and thoughtful you've been about addressing all sorts of issues around making that onboarding and engagement process as relevant as possible to people from so many different backgrounds. And it's also really nice that you've pulled out the point about diverse teams. And it's one of the things that I'm really proud about at Mindwave, actually. We have a really, really diverse team. And I think there's been a lot written about how important that is in, we've all got our biases and the things we don't see, and the more you can have diverse teams working on products, the more you're likely to mitigate some of those biases. Now listen, I'm aware that we're almost at the end. I'd like to just ping through to the penultimate slide, please, Mark. But while you do that, I'd just like to finish just by one sort of final reflection from everyone, which is a bit of a top tip or a top reflection from this. So if people are going to take away anything from this, what's the thing that you would like them to take away, or something maybe that you're taking away from this? So Ilse, start with you.
Thank you. I've had quite a few thoughts during the most recent discussion. In fact, you've probably seen me being very distracting with my arms, putting Post-its up all over the place. One of the most recent comments was around diversity and so on. I was thinking about how if we keep things very human-centric, you get more to the core issues that affect everybody, regardless of status or individual circumstances. I think that's something that's resonated with me through listening to everybody's contributions. And also this idea of the tug of war that happens in developing a digital product for healthcare and the needs of the clients, and how you can kind of put those alongside the needs of the users. And I think maybe the service design approach is key to that, and getting both parties in the room right at the very start, as Manjul said, when an idea first happens.
I love that metaphor of a tug of war, and there is an education process actually, which is about some clients really understanding how important it is to orientate around user needs. Thank you very much for that, Ilse. Nihara, a top tip from you, reflection.
Really hard. Okay, I would just say that in order for digital to work, you've got to invest in the long, hard slog of actually getting real life to work. I just think that no one size fits all in terms of what we produce, and we absolutely need to kind of do the kind of expensive bit about offering our users something in real life in order to offer them something digitally.
Thank you, Nihara. Aaron, what a reflection from you?
Yeah, I'd just like to echo. I've really enjoyed hearing what everyone said. Actually, I've learned a lot from others as well. And I think, but the thing that keeps coming back for me is about, in that conflict that we've talked about, the product market fit, that you're going to go one way or the other sometimes. And I think the critical bit to have to toggle all of that is your values, and to be really strong on what you're trying to do and what your initial intention was. Because I think we've talked a lot about, making it work for users and accessibility. They're all really important, but behind all of that, you've actually got to know what it is you want to do, because I think otherwise you can get torn apart by all of that.
I'm liking all these metaphors: buffeting, torn apart, tug of war. So this is about really keeping that focus on this is the thing we're trying to achieve, and trying to stay true to that. That's brilliant. Manjul, over to you.
Sure. I think the one thing that I'd like anyone who's tuned in still to take away is don't think that you can answer all the questions before you actually take the product to your users. My suggestion would be to prioritize the things that you really want to answer, the things that really matter, and then work your way forward from there, because you're going to learn a lot once your product is in the hands of users. And it's okay to not have everything, sort of all the boxes checked before you go to market, as long as you qualify the main promises that your product is making.
Thank you, Manjul. And last but not least, Stephen, reflection from you.
Yeah, I think I'm going to jump on the keep it simple bandwagon. Be very clear about what you're trying to achieve. This idea that it's easier to add complexity rather than take it away from something that's over complex.
Yeah.
You might think that your app is simple with a nice clean interface, but you're looking at it in isolation. And you're not seeing it as part of a wider service. You're not seeing it part of a wider system, which might already be quite complicated. And also, people's lives are messy, especially when they've got health conditions or disabilities to contend with. They're potentially using multiple apps, multiple assistive technologies. And unless your technology offers a clear benefit, they're not going to use it. They're not going to pick it up. And I think just touching on something that the Manjul mentioned right at the start, that this idea of the three lenses, the useful, usable, and viable. I think that there's the idea of the minimal viable product, but I think we've got something here like what's the minimal beneficial intervention or something like that. That we can promote, that we can build, that we can assess, that we can get out there and see whether ideas work, and then take into account the sort of cost benefit trade-offs around that. So yeah, this idea of what's the minimal beneficial intervention. I'll go with that.
Thank you very much, Stephen. And thank you to all our participants, and thank you for people that have contributed on the chat. We really appreciate it. We have got a hackathon on the 10th of March, and that's just to bring people that have participated, those of you that are interested, to come and collaborate around applying some of this thinking and the deliberation that we've done. So we'll send something out through Eventbrite for people that have signed up to invite you to participate. But I'd just like to finish up by thanking our panelists today, and also the panelists we've had on the other 3 webinars. I've certainly learned an absolute ton. I hope you have too, and enjoy the rest of your day. And I hope you take this learning, apply it, and build beautiful, elegant digital products that change the world and make our lives a better place. So thank you very much. Take care. Bye-bye.